So that is there. So I'll teach you how to clean this, because a lot of clots and everything is there. Okay, so no need to clean it 100%, like, completely clean. Whatever maximum possible you can do it. Every time it becomes weight and it will get clearer and clearer. Okay, we cry whenever we will do this thing, but slowly she will get used to this thing. Okay, yeah. And right now this wound in this area is also little bit swollen,
and whether to touch or no, so we only kept clean on the other side. And
no, that's perfectly okay. Better not to do if you don't understand anything. Okay, because we don't want any kind of injury or trauma or anything. Okay, so that's what I am telling you. Today also I may not be able to clean 100%, but every time you try to clean, it will become more and more clear. Okay, yeah, fine. That down, hold her head so she doesn't move, so chances of injury won't be there. Okay, so every time it becomes, take a like dripping wet cotton, you can buy a gauze paste from the medical store, and some normal saline bottle as well. Okay, yeah. Okay, so at least
if the NS goes into the mouth, that's
nothing fine. Yeah, absolutely, it's going in her vein, so don't worry. Okay, so more it becomes wet, it will easily come out.
Yes.
Oh.
Yeah.
And then maybe you can take a few earbuds, okay, and just wet it in a saline and go inside the nose.
Yeah, done. Yes, I'm doing better. Thank you, doctor. Thank you. She's looking at you.
Yeah, because of the light, basically. Okay, so you need to buy this type of steri strip, okay, and then just cut it half. Okay. Have you got the tea bag with you?
No.
No problem. Jelly lele. So then, and whenever you are using it again, just put it in a boiling water for a minute and then take it out. Okay, don't keep it for a longer time because this is silicone, otherwise it will melt. So like bottle you sterilize, same boiling water, just dip it for a minute and take it out after cleaning. Okay, so it will get sterilized. So whenever you are doing, you have to do it once in a day. Okay, then just half strip. Okay, now this retainer, if you see, there is a flat base and the pointy tip on both sides. Okay, so this will stay on the upside, this will go on the downside. Okay, and the sticking surface should be on the inner side. Okay, so you can just pass this tape from there. Okay, and just stick it. Okay, so one side is ready. Same way on the eye or anything, gauze paste dena, and you can apply little bit, so go straight up or perpendicular, it will go oblique. Okay, so whenever you are doing, just stabilize her head. Okay, and insert both inside. Okay, sorry, and both gently, both little press inside. Okay, and just she will cry for some time, then she will be okay. You will also adapt to that shape and it will be easier to take it out and put it back. Okay, yeah. So if any problem, then only change, otherwise don't change. If you have doubt, come here, we will do it, but after suture removal you have to do. We did surgery on Saturday, correct? So next follow-up will be directly for the suture removal. They will be crying for some time. Yes, okay.